Hello, everyone. My name is Jill Escher, and I am president of National Council on Severe Autism. Welcome to our Share and Care on the coronavirus crisis. This will be the first of what we think will be a series of events to bring together members of our community and discuss matters of importance, in particular to families with children or adults who have moderate to severe autism and are facing additional challenges. Okay, I'm getting questions right now about sound. The sound should be working. You might have a volume problem. Okay, so let's go ahead. Can somebody type in and tell me if you can see the video of all four of us? I would appreciate that. You go to the question bar and just
Someone
type
just
in
said
the question bar.
they can hear us and sound great and everyone can see us. So
I
I
can
think we're
hear
good.
you. Thank you, Dottie. Appreciate that. You sound great. I can see you. Thank you, everybody. You know, this is the first time, so we're ironing out a couple of kinks. I'd like to introduce you to our discussants today. Feda Almalidi is the Vice President of National Council on Severe Autism. She is the mother of two sons with autism, one of whom is rather severe, 15-year-old Mohammed. Alicia Halliday, Dr. Halliday is the Chief Science Officer at Autism Science Foundation. She is one of the people who I think in the entire world know most about autism research and the state of autism science, and she is extremely intelligent and broad-minded about all these topics. And then finally, Dr. Wachtel, who is the medical, oh gosh, you're gonna have to help me, Dr. Wachtel.
The medical director of the
neurobehavioral unit at Kennedy Krieger Institute, which is in Baltimore. And she has devoted her career and her life to caring for children and adults on the severe end of the autism spectrum and with related behavioral disorders. So thank you so much for joining us today, Dr. Wachtel.
Thank you for.
Now, let me be clear, just a couple of ground rules here. We are a safe space. We are a judgment-free zone. No matter what you type into us and whatever stories you have and opinions you have and feelings you have right now, feel free to express them. We do not judge you. This is an extremely difficult time for our families, and we honor your feelings and emotions. Second, no medical advice will be given. Dr. Wachtel is a skilled clinician, but if you have any specific medical advice about your child, of course, please consult your own practitioners. This is for information only. We will record this session and post it on our website and on social media. And I also wanted to thank Autism Society San Francisco Bay Area for sharing their webinar system with us today. Okay, so what you have to do in order to share anything related to this topic today, whether you want to make a comment, whether you have a question, whether you have advice, you guys have already discovered the question bar in the control panel. Just type it in there. Try to be as concise as possible so Feda and I can monitor it without being kind of overloaded. We will do our best to kind of consolidate topics, but it might be that we're very scattershot today and we ping pong back and forth among a variety of topics, which I think is likely to happen. This event should last up to about 90 minutes. And again, this is just the first. So if we get kind of stuck and we need more time to discuss other topics, we will definitely return to those, perhaps with other commentators who have the appropriate expertise. Okay, so I'm just going to kick it off with a number of comments that we've already received. And Dr. Wachtel, this has to do with families who are either sheltered in place like we are in the Bay Area, or who are self-isolating, or who are in quarantine, but with children or adults with severe behavioral challenges. Some of these families are facing violence in the home. They're facing property destruction. Of course, some of these individuals have self-injurious behaviors. And just to start off this topic, which I think might take us a while, Do you have some general advice? Oh my gosh, the webinar has reached its limit of 101 attendees.
Oh,
Oh my gosh. Okay, I might have to sign off for a second to deal with this
Okay.
technical problem. But
Let me take
Dr.
it over from
Wachtel, can you go ahead?
And actually,
okay.
one more thing, Dr. Ruchtel, if you can talk about how our population is considered one of the populations at risk, kind of explain that too as well.
Sure. Well, so I think, we hear a lot about populations that are at risk, particularly older people, people over the age of 60, or people who are dealing with like comorbid medical issues, whether they're like immunosuppressed, patients with like extensive cardiovascular problems, diabetes, pulmonary issues, anybody who would be at a heightened risk of getting more medical complications. And I think our patient population is somewhat different in that having autism and having behavioral challenge isn't necessarily going to place you at a higher risk for complications from the coronavirus, because unless you have a genetic syndrome that has associated medical issues, your medical complications related to coronavirus are not any greater just because you have autism or intellectual disability. But having a disability definitely does put you in a special category, because you and your family are not really in the same position as everybody else, or kind of dealing with the same advantages in terms of managing the day-to-day, I guess, the day-to-day events as they unfold with this new situation that really kind of takes us all by surprise. And I know, like in our own area, there have been some discussions of even among stores when they open for people to be able to come and stock up on provisions. Some stores have talked about opening an hour earlier than usual to allow elderly and disabled people to come, so that they don't have to deal with crowds, they don't have to deal with fights, people arguing over who gets like the last roll of toilet paper. And I think that even though the disabled group, I think in general, people are thinking of somebody coming in with a physical disability, that applies to our families as well, because they're dealing with the exact same type of challenges that somebody who's elderly or somebody who has a physical impairment would be facing out in a public situation that can deteriorate into pandemonium, as we've already seen. I think that, I think this situation reminds me a lot of the families who are on our waiting list to come into Kennedy Krieger. Unfortunately, the service on inpatient is somewhat limited and people wait for a very long time. And we often have families who really are, even in the absence of a pandemic, hunkering down at home, trying to remain safe, doing whatever they can to remain safe. And maybe that means that they're not like following all the instructions that ideally you would get from the ABA professional. There's not a lot of learning taking place. Not everything is running perfectly in the household. And I think it really comes down to looking at what you need to do to keep yourself and your child safe, and focusing mostly on like safety and getting the most basic things accomplished. I mean, I don't have a child with special needs at home, but I do have a child who's sitting behind me playing on his this Nintendo Switch thing that he's like fascinated with. And I'm sure he's going to be doing a lot more Nintendo Switch during the time that we're in this quarantine. And I guess, that's okay, because it's a stressful time for everybody. And so lowering some of the expectations and really getting into that mode of doing what you need to do to keep your child as safe as possible, and also to keep like some of your sanity. And I think it's going to require a lot of like creative thinking, because even though many of our families don't often get a lot of access to help per se, now we're even being told that we're not supposed to have family gatherings or have other people come into our homes, and that's going to put like an even bigger barrier to our families getting what they need.
For so now for the kids that are in ABA programs and their technicians aren't coming in, or their BCBAs can't come in, what are some options that they can do? Is telehealth an option? Some strategies maybe on how to deal with your child's behavior, at least not make it worse through this time.
Right. Well, so I think that telehealth is like rapidly unfolding. And I think before the coronavirus, I mean, telehealth has been growing, but somewhat slowly because there are so many restrictions and state to state and like insurance licensing and things like that. But I've seen in our own facility that with the coronavirus, even in the past couple of days, all of those like prior barriers are coming down. And there's like a rapid like flurry of people getting certified for telehealth. And so I would definitely encourage anybody to reach out to providers that you do have to see it, because it may be that last week they didn't offer telehealth, but that this week they do. And it's not just going to be physicians. I mean, at Kennedy Krieger, it's physicians, psychologists, behaviorists, neuropsychologists. I mean, we serve also kids with, physical needs. So it's somewhat more limited in terms of what physical and occupational therapists can do, but it's not going to be just physicians who are able to provide telehealth. Physicians will be doing telemedicine or telepsychiatry, but other mental health professionals and medical professionals will be doing telehealth in like the more, I guess, global sense of the word. And I think that fortunately, I mean, even with all the legal barriers that usually like keep our country at bay in terms of moving things forward, a lot of people have adopted the kind of the attitude that whatever we do, we're going to do for the patient's benefit. We're going to document like COVID. And if like 6 months from now, somebody from the Joint Commission, doesn't like something, or they weren't happy with like the internet connection and the HIPAA, whatever, I think that we're going to deal with that then, because it really, those issues fade in comparison to being there and offering something to our families now.
Okay, here's a question. 1 second. Here's a question for Dr. Halliday. So Dr. Halliday, people are asking all kinds of questions on how they can protect their kids from the virus because their kid, is not going to wash their hand very well and stuff like that. So, I mean, so what can I do with bleach? Here's a question. How can I use bleach? How can I sanitize my house? How can I keep my kids safe? I mean, we hear stories about people drinking bleach and things like that. So if you please clarify,
I can clarify that. If you can get some bleach, by the way, because I know that it's not always possible to get bleach. If you can get some bleach, you can dilute it 10 parts to 1. So 10 parts water, 1 part bleach. And you can use it as a sanitizer. And you can use that to, you can put it, if you have access to it, some of those soap dispensers that would have soap in it, you can put it in there. It won't foam, it'll just come out, but that's okay. It's just a way to dispense it. And you rinse your hands with it. And then you wash it off, right? Because you don't want to be eating bleach and stuff like that. You can use that same amount and clean whatever it is that someone has touched or they have stepped on, right? Or something that they have touched is touched. So some of the things, and trust me, I get this. We're all going through this in our own households. This is so hard and it's unprecedented, and we're just going to have to figure it out. But one of the things is take your shoes off before you come in the house, right? Because you're tracking you're tracking stuff in from the house. When you take your coat off, right? Because your house is, like your stuff is picked up on your coat. Take your coat off. Wash your hands with the bleach solution, or regular soap and water works too. It's just, hand soap's a little hard to get by right now. So the other thing is that you don't want to, so whatever you hear on the internet from the Reverend Jim Baker or anyone else, you should not be drinking bleach. Bleach is not to ingest. It is only for external use. So whatever you hear about drinking bleach or anything called miracle mineral solution or some sort of solution, don't do it. It's not going to help prevent or treat COVID or any symptom of autism. But you can use bleach to sanitize, your house. You dilute it, your laundry. If if you have a load of whites. I don't want to dismiss the utility of bleach, but don't drink it under any circumstance.
And just to add to what Dr. Halliday said about when people come into the home, I think it's also a good idea to go ahead and have your child change their clothes. Because once we've been outside, anything can be stuck, and it is known that this coronavirus can stick on fabric. So taking off shoes, taking off your coat, having your child change, you changing yourself, throwing those clothes into the laundry. Now would not be the time. Now's the time to be, more vigilant in terms of cleaning cleaning everything that you wear when you do have to go outside. And
Okay.
again, very few people have access to a lot of hand sanitizer now, but soap and water is really still considered like even more efficacious than using those gels. So no matter what type of soap you have, even if you need to help your child wash their hands, even if you need to let them watch like their favorite like video on the iPad while they're washing their hands, that's fine. That's great. I think like we look at maybe now to get somebody to wash their hands, taking out those like high quality reinforcers that otherwise you would kind of keep for more special things. This would be like a special thing. So having your child wash their hands when they come home before they eat, let them have access to whatever it takes to get them to do that, even if you do it with them.
And supplies are coming back. So I know people are freaking out because you see videos of people, paper towels, toilet paper, bleach, wipes. It's not the supply problem, it's the supply chain problem. So things are starting to show up back on the shelves. So don't be afraid to use the stuff that you have now. Stuff is coming back and you will have access to that stuff coming up. I don't know exactly if it's going to be a few days or a week, but go ahead and use the bleach, the soap, the things that you have.
Okay. Here's one more question. What about ultraviolet light? Does UV light kill the virus? If you have like a UV light lamp or staying out in the sun, does UV light kill coronavirus?
I don't think we know the answer to that yet. Now I've seen like on the internet advertisements to buy things like sanitize your phone with like a UV light or like a wand pass over things. I don't know if we have like a final like determination on that. I think I think you have to be careful of a lot of things that are popping up on the internet, and there's advertisements galore, including people selling supposed hand sanitizer that isn't really hand sanitizer. So I think you need to be kind of aware of that. And I guess until we hear like from the CDC that ultraviolet light or some of these other gadgets are really efficacious, I would stick with like what they are telling us in terms of the hand washing. I would also just throw out there in terms of people being concerned about like restocking. So fortunately, in the United States, and even I have a lot of colleagues in Italy, even in places in Europe, and they are restocking. They're restocking supermarkets. A lot of places in Italy are actually offering like reduced cost meals delivered to your home for elderly or for people who are disabled. And I think it'd be totally reasonable if you're at home with a child with special needs and going out to a store is more challenging, call up, the Giant or Whole Foods or whoever and say like, look, I have a special needs child. I can't come and like stand in like a line and fight with somebody to get access to cleaning supplies. Can you consider like when you get a shipment to put aside some for me because this is a special need that I have. Fortunately, we've seen in the communities, a lot of people want to help. A lot of people want to volunteer. And I can't imagine you would get a negative reception from something like that. Unless you say you want like the entire like truckload.
Yeah.
Dr. Wachtel, first of all, I do want to apologize. There's some people are having a registration problem. I did try to address it. So if you're watching this later on recording, I'm really sorry about that. And I hope it's fixed by now. If it's not, it will be fixed by the next Share and Care. Dr. Wachtel, we received some questions, particularly about medications that might help during this time to reduce the anxiety and stress and danger posed by high energy levels and anxiety together in our children. I know we aren't giving medical advice today, but generally, what are some of the medications that people might discuss with their practitioners, or that might even be off the shelf? That could help, reduce the level of anxiety and stress in these children, and therefore, hopefully, prevent outbursts and aggressive episodes.
So I think that's a great question, and I think that So obviously it's all like very individualized and dependent on like what the child is dealing with like at baseline. And I always throw out that caveat that all of our patients with special needs tend to be like very sensitive to medications and have all the like strange and idiosyncratic reactions. So while now is not necessarily the best time to fiddle with those things at home in terms of trying new things without being very cautious about it, I guess I'd kind of approach it from different levels. First of all, looking at what type of medication a child may already be taking to help with mood issues or behavioral issues. And is there any room to increase the dosage of medication? So if someone's on like Depakote or lithium or an atypical antipsychotic and doing relatively well with that medication in regular times, and we're trying to keep the dosage lower to mitigate against side effects, is there room to go up? Is there room to go up just to maybe even tap into some of the kind of sedating qualities of some of those medications to give a little bit more like ego glue or a little bit more of like a buffer? Particularly like thinking about meds that a child is already on, because if a child's taking a medication, then we sort of know that the child can tolerate that medication, and it's not like I'm starting a new medication like an antipsychotic and risking something at home that the child's never been on. So I think that would be kind of my first thought, is increasing medications that a child's already receiving, optimizing dosages, and even being willing to tap into the sedating qualities of medications that we usually want to avoid, so a child can take best advantage of, of learning and participating in the community. But now I guess I'd sort of see it like, what might you do if your child is recovering from surgery, or you had to take your child on a transatlantic flight, something that you would need to do to sort of bring things down like a couple of notches. Um, I think in general with behavioral dyscontrol, we're wary of benzodiazepines because of the fact that many of our patients become disinhibited. But that being said, some patients respond wonderfully to them. So I think it's a question with medications like that, benzodiazepines or antipsychotics that we'll use for acute behavioral dyscontrol, working closely with your practitioner, starting with like a low dosage of the medication to make sure that the child can tolerate it without adverse side effect. And then really going up relatively liberally on those medications if the situation is acutely out of control. I think that particularly keeping in mind that the regular health systems are going to be saturated, like beyond saturated with people with coronavirus or concern for coronavirus, and showing up in the emergency room with behavioral issues, you're just adding to like the pandemonium and also adding to a situation where you don't necessarily want to be if you can avoid it.
Actually, we have somebody that wrote in that said, thanks for mentioning that we have mom guilt. I have a lot of guilt as a mom during this time because I can't do anything. And you just saw my son came and asked for Cheetos, and I just gave it to him because I can't follow through. So we all understand, we're all moms, we all have kids with autism. So, and we all know that we're doing the best we can. And we're just all trying to get through it together.
I'd like to stick just for a minute on the medication issue. I know that you, Dr. Wachtel, that you don't deal with medical cannabis, but I'm one of the parents. I will freely discuss the fact that I am one of the people who does use medical cannabis with my son in order to reduce his anxiety and reduce his behaviors. And while we don't have anyone on the panel today who's an expert on this, and not that anyone is an expert on this topic, I would like to refer people to an online group called Whole Plant Access for Autism. That's the number 4, WPA4A. If you feel like that might be an alternative for your child. I will say, my experience has been mostly very positive. And right now, I don't know if we would be able to survive this period without that particular medication. And we have tried various pharmaceutical medications as well that have not been as helpful. So again, this is not my medical advice, but I do think that it's something worth exploring if your state allows it. Okay. And one more question. Oh gosh, we're having registration problems. One more question on medications, Dr. Wachtel. So I know you said this isn't a good time to start, but if a family is desperate right? And they're experiencing something in the home. Um, would you advise them to use telemedicine to connect to a practitioner and just maybe try Abilify? I'm not promoting these products at all. I know that they have side effects and everything, or risperidone, or one of the beta blockers, or something. I think a lot of these families are feeling quite desperate.
Absolutely. No, I think the key really is to like tap into telemedicine and make sure that you're working with a practitioner, because the last thing you'd want to do is just sort of try haphazardly, like through whoever would give you a prescription. But working with somebody through telemedicine, I mean, now, in some ways, like telemedicine may even be better than for our families, because it reduces the component of bringing somebody into an office where they really don't want to be there, and where the parent's just spending time managing their behaviors and isn't really able to participate fully in the interview. Um, and so, yeah, I think as long as you're working with somebody who is able to provide ongoing care and help with the monitoring. So whenever you start a medication, really what happens after that in terms of how does the child respond, and making changes and being able to make changes quickly. As long as like pharmacies are able to supply medication and you're able to work with a practitioner ongoing, I definitely would support that, because there are a lot of options out there, whether it's optimizing meds that a child is already taking, or looking at starting something like the atypicals, Jill brought up beta blockers, even alpha agonists like clonidine or guanfacine, to just tamp things down like a little bit. Those are all options out there. And tapping into telemedicine, I think, is really going to be the way to go for what could be like several weeks to, if not a few months.
Is there a medication that, let's say the patient is having an episode, right? Is there something that can be given just temporarily, maybe not prophylactically, but temporarily, to just calm that patient down in that
Like,
moment?
sure, well then you're looking more at like antipsychotics or benzodiazepines that would have a pretty like rapid onset of action. And I guess with the risks of some of the antipsychotics in terms of having like a dystonic reaction, if a child's never been on one, I probably would go for a benzodiazepine first. And typically those medications have an onset of action within like 20 to 30 minutes. And worst case scenario, the child, well, they can become disinhibited or may become tired. And in this situation, if they're out of control and they're become tired and want to go sleep on the sofa, that's actually a good thing. And we certainly use those like for kids who are recovering from surgery, when you're in a desperate situation and you need to get some traction.
Okay.
I just want to add something.
Oh, go ahead, Alicia.
I just want to add something about that. So with this advent of telemedicine, ask your doctor to prescribe it prophylactically so that you have it, right? Discuss your concerns with your doctor before they even happen. I'm concerned that, this lack of routine is going to send them into a spiral. I'm concerned that, that I am not going to, like, it's going to get so bad that I'm not going to be able to control it with whatever behavioral measures I can. Tell that to them. The worst they can say is no. But the best they can say is, let me give you 10 pills, and then call it into your pharmacy, and then you have it if you need it. I think that there's also a lot of people, and I want to address this, that is a little bit nervous about telemedicine, because they don't want telemedicine to replace those really important, crucial inpatient face-to-face visits. Don't worry about that. Take advantage of telemedicine now. Don't worry about whether or not the government's going to rip your clinical visits out from underneath you. That's not going to happen. We're using this as a stopgap. Use it as a stopgap and get whatever you can from it. Ask your doctor for 30-day or 90-day prescriptions if you need it, because you don't really want to leave the house. They're amenable to that. My doctor wanted, normally wouldn't give me Ambien for 90 days, but they are. So here we are.
Okay, I promise this will be the last question. Sleep. So we've got some questions about sleep. So Dr. Wachtel, do you, like, for example, my son is on trazodone, high dose, 200 milligrams per night or so to sleep. Can you just say something about that? Because that's also something people are experiencing.
Not being able to sleep. Sure. I mean, in addition to the baseline issues of kids with autism having difficulty sleeping, there are lots of options out there for sleep, whether it's trazodone, clonidine, Intuniv, using a benzodiazepine. Neurontin is something that will often use and really like stack the dosage in the evening because it can be sedating and also helps with anxiety. Another thing we like to do is take the medications a child is already on and see if we can, again, kind of stack it favorably towards the evening. So if they're on an atypical Depakote lithium, can they take a third in the morning and 2/3 at night to really optimize the chance that they're going to sleep through the night? So yeah, I think there's a number of options out there, and I would maximize those because I think caregivers also are going to need to be able to go to sleep at night. And this is stressful and anxiety provoking for everybody. And parents are going to need their kids to go to sleep so they can like decompress and maybe have a glass of wine or watch something on Netflix and get some sleep before they're getting ready for the next day. So I would encourage people to consider, whatever options help your child get to sleep and not really worry. Now's not really the time to worry about, my child's going to be taking a benzodiazepine for a couple months. Okay. Or they're going to have some spillover sedation the next morning. Okay. Those are things that can be dealt with like after the crisis is over. Medications can always be weaned when other options become available. I mean, when kids are able to go back outside and run around and play, they're going to get tired and go to sleep better. It's a lot easier to sleep when you've been running around rather than sitting in the house all day. So those things are going to change. Unfortunately, doesn't look like they're going to change in the next few weeks, but so we need to do what we can to get through those few weeks.
And melatonin too.
Sorry, Dr. Halliday. So I have some questions. For those people that are not in lockdown, and they still can have ABA therapy sessions, should we cancel our in-home sessions?
I'm on mute. I'm sorry. Should you cancel the in-home sessions? No. I would contact the provider, right, and ask where they've been, what they've been exposed to, and you should judge individually that level of risk, right? So if your ABA provider has just traveled from Italy, maybe no. If there is no, obvious increased risk, the answer is yes. You should obviously make that decision on your own. You should obviously have anyone that comes into your home do the same things we talked about earlier. Take your, jacket off, take your shoes off, wash your hands, make sure anything that the provider has touched has been cleaned with the sanitizing wipe. Have your child wash their hands after they've had any sort of contact with that person. Monitor the health of that person, right? You might want, we went out and got a thermometer to just kind of do a quick monitoring of anyone that comes into our house. Not that that's 100%, right? But at least it's something for people that may appear to or may not say they have any symptoms, but do. If you can get a hold of a face mask, do that. But I think for many kids who are not under restrictions, these ABA providers provide I think more than anything, they provide a level of regularity and routine. Just like Dr. Wachtel said, if you miss an ABA session, if you miss something, it's in the grand scheme of things, we're just trying to work things out, and it's not going to make or break anything if you miss 1 or 2 sessions, except for the fact that in the short term, you and your child will probably have a little bit of problems if you're not maintaining that routine. So I would take precautions, and that precautions means really kind of vetting the ABA provider that comes to your house.
And I do want to mention that ABA providers are considered essential health businesses that just stay open during the break because they care for people with disabilities and the elderly. So they are exempt from having to close. It's obviously up to the provider, but just so you know, it is an essential service that should remain open. So here's another question. My son needs his routine, and he's not going to school. All he wants to do is go to school. How do you suggest these kids that are routine based, that are used to like, I go to school, then I come home, and then I do this, and what do you do with that, and how can you best help families deal with that? just, I mean, it's going to be hard for all of us, but what are some simple strategies?
So I guess when you're looking to, when you need a routine and your usual routine has been really disrupted, I would encourage people to think about how can they create a new routine? How can they take like what's available within the home and also what's become available through the internet. I'm not exactly sure what's available in terms of special education modules, but there's a huge number of organizations out there that have now opened up like their online learning for free. I mean, even like Harvard's offering like free courses for college students who have been sent home. So if it's possible using the internet to recreate some type of like learning experiences, include your child like in the choice. Look, it seems like all of our patients love being online and love having the internet connection. So that might be something that they'd enjoy. See if they're able to help you choose those, come up with like a new schedule of things that you can do within the house. Even like simple things like doing like chores in the house, taking the laundry down, making your bed,
Cleaning the doorknobs.
Exactly. Cleaning the doorknobs, right? I mean, it sounds like people are going to be doing a lot of laundry. So taking the laundry, moving it into the dryer, putting away the towels, anything that you can add in, even if it's things that you usually do, see if your child can help so that can become like a new part of their routine.
Can
and again, like if there's more TV and more game time right now, I don't think that's the worst of all things. So if that adds the routine and it's like an extra couple of hours of watching whatever, like Sesame Street, like for the umpteenth time, all right, well, I guess it's not the worst. It's not the worst thing considering like the times that we're in.
Yeah, I mean, I can tell you as a mom, I wasn't more concerned with the toilet paper as I was concerned with having detergent to wash all the laundry because my son is incontinent. I mean, so I was more scared of laundry than anything else, than water, not having bottled water. Jill, do you have a question?
I think you went on mute.
You're muted.
I'll just add to the routine. Oh, go ahead.
If routine daily walking, lots of it, is a fundamental therapeutic activity for our severely autistic adult son, how do we prevent his group home staff and the state administrators from confining all his activities to his small group home? Because he is living in the community, this restriction appears as discriminatory. Other neighbors in the community are free to take walks outside as much as they desire or need. Let me explain. In California, in the Bay Area where we are, and I'm guessing that this question is coming from the Bay Area, we are in this shelter in place order where we are allowed to go out and take walks so long as we're the advice is 6 feet away from the other person, unless you are living in the same household. Then you can, be together. And I think this mother seems to be concerned about a group home restriction, which would keep everybody indoors 24/7. So I can't really speak to the discriminatory aspect, but I would certainly work with the group home administration, with the staff, to say, hey, you are under the current directives from our county administrators. You are allowed to take walks with people who live in your household, right? It's not like there's a directive to stay home on lockdown here. So I'm not quite sure. I think maybe group homes, they tend to have restrictions in how they operate because there's fewer staff than there are people who live there. And they can't often do one-on-one activities. So somehow I would say that has to be supplemented. If you can find other people to help your son, if you can go over and help your son, if they can divide up the day somehow, there's no easy answer here. Does anybody else want to speak to that?
I would say that probably group homes are just like the rest of us. They are overwhelmed. They also are getting these sheets of paper about what they should and shouldn't do, and they are confused about what they should and shouldn't do. And absolutely, you should get outside and, obviously, but like if you see somebody on the street, don't give up and give them a hug. I've been doing this. But you can get out and go for a walk. You can go out, and my daughter, who's on the spectrum, has been running to the back of our yard and back of our yard and back and forth, back and forth, back and forth for hours at a time. that's okay. I just think that probably some facilities are confused, and guess what? We're all confused. So, we'll try as much as we can to post guidance, and then that way you can show it to them and say it's okay. You can do this. I think everyone's doing their best, or at least trying to do their best, but there is a lot of confusion. So as much as we can provide documentation to do that, I think they're just trying to think in the best interest of your son.
Yeah, here's just a comment. Oh, go ahead, Dr. Rochelle.
Here's a question from a mom. That
Wait, hold on, Beta. Dr. Wachtel, you were going to say something?
Sorry.
Just wanted to make a comment about public playgrounds. So it has been suggested that people avoid public playgrounds, that the virus can last on the plastic or synthetic surfaces of public playgrounds for quite some time. A lot of places have closed public playgrounds. If you have like a playground in your backyard that's just for your child or your family or just for the group home, that might be a different story. But public playgrounds would not be a good idea. So yeah, thinking about things like walking, if your child has a scooter or bicycle, anything that's outside is actually fine, as long as you're not, again, doing it like right next to somebody, unless it's somebody that you live with.
Okay. Somebody from Boston, just to, commenting, it's been chilly in my area, but I've been taking out my child every single day for a long neighborhood walk, and so far it has been great with regrouping with her since her break-in routine. I also created a calm down space for her in a small area of my home just for her needs. I like the idea of the calm down space.
If a person has a calm down space, Jill. If a person has a calm down space in their house.
Yeah, if you have the calm down space. And even I've heard that people, we had this anyway in our house, but that's okay if you don't have it. If you have the means, Amazon is still doing deliveries, but to create like a sensory kind of environment, we have kinetic sand and we have squishy balls, and we have even water beads, even though I know like totally unsanitary, but only she touches the water beads, but and we dispose of them. But I mean, if you have you have a place and there's like a sensory area, that seems to really in some people help, is to include that in the calm down space.
And you don't necessarily need to buy new things, mattresses, pillows, blankets. You can be creative with what you have in the house, even if you can't get new things or specific sensory items.
That's great. Yeah, I'm not as creative.
Somebody wrote in saying she has a Facebook group that has a whole lot of resources on how to keep them occupied, resources from teachers, OTs, PTs, speech providers, and she gave me a link. We will put it on Facebook and on our website.
Okay, here's a question. My son has water aversion and will not wash his hands. What can I do to keep his hands clean? There's no sanitizer out there, and this kid has a complete water aversion. So go ahead. We got 2 doctors. Shoot.
So my suggestion would be to put, well, first of all, hand sanitizer, even though it's better than nothing, has been thought to maybe rub around stuff. So I wouldn't even say hand sanitizer, like the Bed Bath and Body Works stuff, or Bath and Body Works, the one that's not like chemically oriented, it's just a gel. Might just spread it around anyway. It doesn't have alcohol in it. It doesn't have triclosan in it. But
Mom specifically said we don't have hand sanitizer.
You don't have hand sanitizer. If you have any sort of soap, like even if it's hand soap, even if it's the pump soap, even if it's any like dish soap, these are desperate times. Put it on a cloth with some water, and wipe it. Have him wipe his hands. It does have some water in it. He may not like the temperature. He may not like the sensation, but it's going to be better than sticking his hands in water. The thing is, the soap itself kind of pulls away and resists the virus, and so you really just want to use that as much as you can. I would love to suggest using those Clorox wipes. Those are in short supply too, but that's another option once they get on the shelf. But just any amount of like little bit of like even Dawn soap with either a paper towel or even a towel that you can wash, and then just like get it and get it all the way up from his elbows.
Yeah, if there's a way to make a game out of it, out of some type of like water play that would involve soap, if you have to use like reinforcers, I mean, to get them to tolerate that, I think those
Like,
things
I'll
are
give you
fine.
a whole bag of Cheetos if you wash your hands, that kind of a thing.
If you wash your hands, you get like, yeah, a big bowl of Cheetos, fine. For now, that's like totally great because the risk of eating the Cheetos is like, that can be dealt with later. And again, I would encourage people like that whose kids like absolutely will not deal with water and soap unless like they're really forced to talk to like the local stores about that fact and to let them know that you are a special needs family. And as soon as they get some of those things back on the shelf, whether it's a Clorox wipes, Lysol wipes, hand sanitizer, say like I have a child who doesn't wash his hands, that I can't do that with him. So please, would you consider me, because I'm like a special needs category, just like somebody who's 70 years old or someone who has congestive heart failure.
The other thing is people in your community really want to help. So I have been overwhelmed on Facebook with offers. I put myself out there, and so have other people, to help deliver meals for the elderly, to go grocery shopping for the elderly. And there are people on Facebook that you can reach out to who really want to help, who want, to share their supplies with you. They have, free cases of Clorox wipes. Maybe they want to share it with you. I don't love social media, but I think this is the time that people are shining on social media. And in fact, if you want to go on social media, or you have an account, or even want to generate an account to go and reach out for supplies that you absolutely need but can't find, this is the time to do it, because people really are kind of out there helping.
If you're part of
Not
like
everyone.
a neighborhood group, a church group, a synagogue, and you just put that out there as like a need, I think that anything that you can do to try and get access to those things, I think it's really nice that people are trying to help. And I think that that's only going to continue. If we look at like what's going on in Italy, where people are offering to bring you a meal for like €1, it's really awesome. And I think that that's definitely going to come here too. So reach out, ask, let people know like what you need.
Now, what about the use of gloves? Will gloves help mitigate the virus, since I don't have access to other supplies? So if you don't have Clorox wipes, you don't got bleach.
So you don't have, I mean, this is kind of unusual. People who don't have access to some of these things. I mean, my store has been sold out of gloves. I mean, what the advantage of gloves is that you can go out, put on your gloves, go out, and then take them off and throw them away, and then put on a new pair. It's definitely better than nothing. People tend to forget how long they've had their gloves on, what they've touched while they've had their gloves. They think, oh, I'm wearing my gloves, so they can touch things, and then touch, cups, and then take their hands off and then touch the cups. So you still have to be very vigilant. But if you're going outside, or you're going to, a grocery store or something, you can put on gloves once you get out of your car, wear the gloves, and then throw them away once you get back in the car. It's definitely better than nothing. I'm actually very surprised that people have access to them, because they seem to have gone the way of paper towels and toilet paper.
Right.
Well,
yeah, they're really hard.
Parents who have kids that might be like incontinent or have those kind of issues, we were stocked up on gloves to begin with. So we were ahead of the curve.
I thought I was, but I really wasn't when I think about, so yeah, okay.
I just wanted to comment on a couple of comments that have come in. We've had a couple people write in expressing how useful cannabis has been for their own children. Also, some comments, just like this one, what is your advice for parents who feel guilty about not doing the homework and about the lack of learning in general? I can start off and say, have no guilt. I mean, there should be no guilt whatsoever. Zero guilt. Zero guilt. No guilt.
Don't worry about it. So this is something that I'm dealing with. I have a daughter on the spectrum who's in one class, and I have a daughter who's in another class, and the daughter who's doesn't have autism is literally losing her mind over this. She has anxiety anyway. She's freaking out if she's going to miss an assignment. How do you hand it in? The school districts are handling this each in a different way. That's okay. Listen, this is an emergency crisis situation. I'm not judging the schools, but some schools are restricting it to review. So during the next few weeks, they'll only be doing review materials. Some schools are only doing Google Classroom and are introducing new materials without any supportive teachers. And then other schools are actually having Zoom, all day. They're on the computer with, some sort of video conferencing. These are extreme times. Give yourself a break. If your kid does not learn what an obtuse angle is, guess what? They're going to be fine. The most important thing right now,
okay.
I just remembered what it was today. It's okay. What's going to happen, even if they're out of school for the rest of the year, even the kids that are in, if you have a child who has autism and you have a kid who's in like honors English, tell them to read a book. You know what? In the grand scheme of things, the way I see it is that you're teaching your kids to be loving and caring and helping with the community and being part of the bigger solution than learning academics. I mean, I'm not saying these things aren't important, but I'm saying there are more important things. So don't worry about it. Give yourself a break, especially if your child is in between meltdowns. If you have one child who is stimming and self-biting, and then you have another one you feel guilty isn't, working on their homework. I don't know how many people out there ride Peloton, but I ride Peloton mostly to reduce stress. And there's an instructor that his mantra is, it's not that deep. So it's really not that deep. We have to get through this health crisis and manage kids' behaviors, and then worry about whether or not they know who was in Moby, who was the lead in Moby, or like who the anyway.
Protect.
Yeah.
Yeah,
Thank
I
you
would
very
say,
much.
the
Apparently,
number
I was in a little coronavirus bubble when that was being taught.
Our goal here is to keep all of us parents and caregivers safe over the next couple weeks, maybe even longer, and to keep all of our cherished loved ones safe for a couple weeks. And everything else, for months, everything else is second to that. Just know your primary goal. And also for those who have the functional abilities, as has already been said, it is a time where you could focus just on learning by doing basic household tasks, basic hygiene tasks. Lord knows I really have to work on shaving with my son. Well, now I have some time. Working on teach him to do the laundry, some dishes. Obviously, a lot of our kids, like my son, are not really capable of that, but some of us are. So the most important thing, though, is your health and sanity. Fada, did you want to take another of the questions?
Yeah, I do, but I do want to say something just as a mother, and anyone can be habit trained. Anyone can be learned to do one thing over and over and over and over and over again. So I think that like if you do it, I'm just saying habit training does work, practice. So here's a question. Are the waivers providing agencies able or obligated to provide increased hours to the community hab workers due to my son's behavioral challenges? So for example, there's an ABA agency, let's say it's still operational, and they're providing hours to a kid. This would be the time to ask for more hours. For example, Dr. Wachtel, is there an argument to be made to be able to increase the hours of treatment? We're not saying now if they can find the providers or not, but to get the authorization in place.
I think you have to think about that really carefully, because we also know that a lot of people, are going to be spreading this virus in what they call like a stealth manner, and that people may be asymptomatic before they actually, become obviously ill, and what will still be like shedding the virus. So I think I would encourage people to, as much as like additional help may be really warranted or desired, to kind of think carefully about just how many additional people you actually want to bring into your home, particularly if you have other people in your home, like older parents or other people for whom the health risks of coronavirus would be more severe. There's definitely something to be said for reducing like the number of vectors that come into your house, in the same way that there's telling parents of typically developing kids that this is not a school break where you have play dates. I think that's a little, I would imagine that those services aren't even going to be available because so many people are going to be wanting them. And I think a lot of people are not going to want to provide them or be able to provide them. I'd also just kind of throw out as a cautionary note that a lot of the people who do provide those one-on-one services are in that like younger age category where we're already seeing that it's hard for them to take some of these suggestions about social distancing, to the point that a lot of our cities are having to close like restaurants and bars and places for social gatherings. And just to keep that in mind, that that age group might not be doing the same job that we're trying to do, in the somewhat older age groups of social distancing, and really weigh like how much you want to risk bringing a lot of people into your house versus how much you want to risk potentially, spreading the virus. I think that all of that needs to really be considered. But on the other hand, I mean, getting through the day and surviving, I think that's something that our families are dealing with as well. But just caution people to keep that in mind. And if you do have like a group of people working in your house, like young people, just to even have that conversation with them that you're not there to police them. And obviously you can't control their actions, and that you get it, that, if you're 21, like, yeah, you want to go out and like have fun with your friends, and, nobody 21 likely is going to get ill, but to please encourage them to keep in mind that they're working with people who are more vulnerable, and that just to kind of keep that in mind when they're making decisions, when they're not working with your children, about what they're going to do in terms of social distancing to limit the risk.
I wanted to just read some of the comments that have come in. This mom says, I just wanted to validate the need to indulge our severe kiddos without guilt, exclamation point. Her day program closed last Thursday. We've increased sedating medications, including medical marijuana, letting her eat more snacks than is healthy, take numerous water play baths, anything to keep her temper tantrum to a minimum. No guilt, safety and sanity first. Thank you for that comment.
Good for you, Mama.
Another comment. After homeschooling my son for 9 years, I found using everything my son loves, i.e. animals. We watch an animal show or documentary together. We build animal habitats with Legos. So many ways to use what they love to create a learning environment without stress, pushing the child, and it's also a way to connect. Okay, I think we're going to move to a slightly different set of topics now, and that has to do with financial stress. I know we've kind of touched on this a little bit, but we see parents who are often unpaid caregivers for their children. We also have parents who are, at least in part, through Medicaid, various state Medicaid programs, paid caregivers for their children or adult children. We see families, obviously, people losing jobs, and sometimes additional expenses. So does someone want to talk about, I don't have a particular question to start off with, although I'm going to scroll through and see if there are some, but there's concerns about insurance. There's concerns about family medical leave. There's concerns about how the Medicaid waiver system is going to reimburse programs and individuals. Does somebody want to start on the general topic, and then I'll come up with, I'll look into the specific questions.
I mean, if you would like.
I just want to say that is certainly, everyone is feeling this, right? So everyone is feeling this. Everyone, what if you are a mom who's a waitress and your restaurant just closed and you're not able to earn tips anymore, and now you can't pay your insurance deductible? And I think that there's just like this whole, and I can name a million other. I have friends that are in the entertainment industry, not like, they're not like Jimmy Fallon. They're like, they're bands for different events. And so they've actually lost a lot of business through April, and they're unable to pay their bills. And sometimes, medical insurance is one of the bills that they can no longer pay for. And everyone is feeling this. My hope is that, and this is my hope, that the government is going to introduce legislation that is going to make the financial hardships a little bit easier for some of these more vulnerable groups, right? Like not groups that, sorry, my cat, not groups that are, you would typically think of, but those trickle down groups, I mean, you can probably name them, and that includes trickle down into, the economy, right? What you can do, and there's a number, so if you're you do have a Medicaid waiver and you are on Medicaid, there are certain things you can take advantage of within new Medicaid regulations. I certainly hope that there will be new insurance kind of guidelines for private insurers to allow things like, enhance, there has been for Medicaid, but for things like private insurers for things like telehealth and even everything from being able to, get 3 months of a prescription rather than just 30 days of a prescription, and, maybe expand some of the coverage. That depends. So the insurance part really depends on who your insurer is, whether it's a private or a RISA insurer, and what your baseline coverage is. But I do understand that a lot of people are feeling it. And I do hope that there will be some sort of, economic aid package to help those families, because there's a lot of people that are feeling it in the trickle down.
I think that's already being discussed in Washington, how to help those most vulnerable families. And it's become very clear that something needs to be done. Hopefully it will. And I guess it depends from employer to employer, but a lot of employers are already coming out offering a certain amount of time that they're going to guarantee salaries if you're not able to work. That's not going to apply to everybody, but I think that that's being taken very seriously across the country, recognizing that this is a really extraordinary time and the regular rules can't really apply without there being dire consequences for people.
There also, I have heard nice stories about how, like in Austin, Texas, or maybe it's all of Texas, Governor Abbott has said that there can be no evictions in the next, 90 days, right? So people who can't pay their rent are not allowed to be evicted for their apartment, that insurance companies must continue. Oh, in California too? Great. I didn't know about that. Insurance companies need to extend, like if you don't pay your premium, they can't cancel you after 30 days. They, now have to.
There's always a grace period. Yeah.
There's the grace period. And so, that's the sort of thing that some of this new government legislation, which hopefully will be passed, will target and help, those families who are literally getting by day to day as it is.
Yeah, and then something else, the Social Security Administration came out. So if your job and you can't work, not just because you're infected, no, if your workplace is shutting down because of the coronavirus, you don't have to wait to apply for Social Security, for unemployment. You can apply from that first day.
Okay.
So, and then there's a link, and we can send that link out.
Yes.
So
if there's like a website
organization is affected by it, then you are entitled to it. And they're speeding that up, they're expediting that. For health insurance, there's always a grace period. As of now, currently in California, most plans are not allowing to bill for telehealth as of now, but I think that's going to change very quickly as things change. I think practically a lot of providers, if they can't bill, they're going to struggle to keep their doors open. And those are the providers that we're going to need when we bounce back from this. So there's got to be a way where the plans work with the agencies that serve our kids, maybe to put in some kind of a stopgap measure where they might provide some advanced funding, at least to be able to keep them open till they come back. Because we're not thinking about the long-term consequences. Yeah, we're staying inside, but once it's all over, where's the staff? Where are the agencies? Can they support themselves? Can they keep their businesses open? We're already short on providers for our population. So I think there's got to be a very thoughtful way to really look at this, and we do have to come together.
That's a good point. And, I actually, think about that. Like, I know that there's a lot of families, without a child with autism that's like, well, my child's daycare is closed. Why do I still have to pay them? And it's like, I totally get it, right? Like, your child isn't in daycare, But think about that. How are you going to allow those people to pay their bills and then actually allow that daycare to come back after this is all over if nobody is helping them, pay their costs? And so this is all just like, it's all like trickling down. And so I get it on both sides. Like, yeah, I mean, I don't necessarily want to pay for, some of Sarah's services if they're not being used, but at the same time, you want them when they come back. And so I think that's what some of these stopgaps are designed to put in place, is to make sure that they're there when we come back. When we come back from this, which we will, things you have those services and you don't have to start from zero again.
Exactly. I think we have to figure that out as a community.
Yeah, and I'm sorry if this was already mentioned, but the Centers for Medicare and Medicaid have said that there would be more flexibility in how things are provided and paid for, and I can provide a link to that statement. It's an emergency declaration from CMS. I think it was issued yesterday, and I can post a link to that. It's a little bit lengthy and detailed to go over right now.
Just one other thing about telehealth. I mean, if there's any silver lining in some of the emergency telehealth advancements, would be to think about after this is all over. And we deal a lot with the barriers of telehealth that prevent us from, helping somebody who lives in another state where it wouldn't be safe for them to bring their child into the office, and where we're not allowed to help them because we're not licensed in that state. And when this is over and some of those barriers have come down, then there's a good chance that some of that might be able to continue, and hopefully it won't go back to that same, like, here's a stone wall, I can't help you because you live in Nevada, I'm practicing in Maryland, it's not safe for you to bring your child here, and I'm not a licensed provider in Nevada, sorry. So that might be one positive thing that is going to stick with us after this is all over, because yeah, I think it's going to open up some doors.
Let's go take a couple more of these comments and questions. Here's another one on the financial issue. Since we don't know how long schools will be closed, anyone out there taking medical leave, or are most working parents working remotely? Right now working remotely, but it's near impossible, which I can completely understand. Can anybody outline, like, what are the options for these parents? Medical, family medical leave, working remotely, but it's very, very hard. Going on unemployment if necessary, but I think they have to have their job terminated to do that. They can't voluntarily leave it.
No, that's not true. The new regulation is not that.
Go ahead, Peter, sorry.
I would say that if you can keep, again, if you can keep your job working from home, even if you have to modify your hours, or even if you have to make adjustments, that's probably your best bet, right? Like, nobody wants to go out and have to find a new job in 6 months or a year. Nobody wants to, even with unemployment, you're not going to make as much as on unemployment as you would be. You may lose your health benefits. So the number one, I think, if you can somehow make it work, and believe me, I think that I've heard stories of employers which were like, we will never allow teleworking, and now they're like, yeah, well, you can work from home. So I think that employers may be more amenable to adjustments in that work policy. If it's not possible at all and you have to take family leave, you are entitled to take family leave because you have to care for somebody in your household. That family leave entitles you to, I believe, up to a year. In certain states, you get a certain amount of that paid and then a certain amount of it unpaid. It depends on the state, and you should look online. So, it depends, but you could get 6 weeks, 3 months, whatever, fully paid, and then whatever else unpaid. But you essentially, for a certain period of time, get to keep whatever health insurance you have, and then you're allowed the COBRA, which you would have to pay for. But and then, I think as Feda said, if you wanted to take unemployment, I think that would be another option. You don't ever make as much on unemployment. You make something, but you never make what you would if you were working. So that's why I'm saying, if you can make it work at whatever position you have, I think employers are being they're trying. I'm not saying they're all like this. They're trying to make it work. These are people that I know that were very stalwart. You're never working from home. Now all of a sudden they're changing their tune. So, they realize you're a good employee. They don't really want to lose you. So, those are some of the options, but I would say you would try to make it work from home if you can, even if you have to adjust things. There used to be something a while ago called job sharing. And I had a family member that did this, is that they did 20 hours a week and then the other person did the same job, but the other 20 hours a week. That was kind of phased out because people thought it was too expensive and too redundant. That may be coming back again. And you may want to suggest that, right? Is to say with another employee, can we job share? Can we split it? Can we say, I'll do these days and you do these days, or I do these hours and you do these hours? I mean, I think these are all options that are open, but if you can keep the job you have with alternate hours, I think that would be really
Can
the
you
best
job
option.
share with taking care of Moo with me? My son.
How could I do that in New Jersey? So like, that's the problem. I would love that, but like.
All right. I'm going to go back to a few more of the
Here's
comments.
one
I'm
more
sorry.
parent. One more parent. They're saying the schools are closed, but some schools are open for picking up for lunches, reduced and free lunches. So I think that's something that people should take advantage of. It might be actually good for the kid to walk to his school and get the lunch and leave. It might be part of a routine. But there are things out there for the kids that are on free and reduced price lunches.
I thank you for mentioning that. That was one thing that, I think a lot of schools kind of like dragged their feet on closing because they were worried about the kids who were on free and reduced lunch programs and what they were going to do. And they came up with a solution, but people should be taking advantage of that solution.
Yeah, here in Maryland.
We have a question. Oh, sorry, Dr. Roxell.
Oh, no, I was just saying, at least here in Maryland, so the schools are open to provide, it's not a hot lunch per se, it's something that's packaged that you can pick up and carry, but it was implemented pretty much immediately. So yeah, absolutely. If that's something your child was benefiting from before, I think that since it's not hot lunch, but it's something that's packaged, you can feel pretty comfortable in going to get it. And yeah, and make that part of the routine, make that part of, what we do. We walk over here and we get this up and pick this up and, talk from a meter away to wave at our friends and then go back.
I mean, go ahead.
No, go ahead. It's okay, Fiona.
What I was saying is there's a lot of people saying that our schools are closed. And one mom here wrote that she's a nurse and she has to now stay home with her child. And I heard some data that almost 40% of nurses have school-aged children that go to school. Now, when they have to stay home and take care of their kids, we've just cut out 40% of the workforce, of the nursing workforce that we're going to need to combat this thing. So it just goes to even more that we really have to be thoughtful and not just think about ourselves. Oh, we're closing the schools. What are the repercussions around that?
Yeah.
You're cutting out a lot of those frontline people.
Yeah.
Right. So we have a question from a teacher. I'm a special education teacher who works with 3 to 5-year-olds who are significantly impacted with autism. What should I really focus on when providing, quote, distance learning, unquote? I mean, that's really hard.
Yeah.
I think that at that age, you're not going to get a lot of attention from these kids.
Getting something to keep them occupied. Anything like to keep them occupied.
Movement. Yeah, I think it's going to be hard to do any type of like sit down, like paper and pencil type of learning, but anything that is involving like, whether it's sports, art, music, something that you can that can grab their attention.
Music is a big one. I mean, at least for my kids, if there's one thing to grab them and hold them for a while, it's music. So you can telesing. You can telesing circle time.
And parents, I've seen parents come together during this time, like on Facebook. If you have a Netflix or Disney Plus passcode that you can share with a fellow family so they can, watch more stuff. I mean, it was one thing to be quarantined with my kid, but to be quarantined Dora the Explorer. Mm-mm.
Yeah. Well, and
So-
look on because there's several of those programs. Like we got emails this morning that I think it's both Scholastic and something called ABC Mouse. Several of them are like waiving their fees, making it available to you for free. And if you have a child in the public school systems who has access to online learning now, look to see what they might have access to, even if it's designated to the kids who are typically developing from art and music. I mean, my son, who's 9 years old, we got a link this morning from the music teacher of things that she's put together, to help the kids keep them occupied so they can still learn about music and have that joy of learning music and see if that's something that your kid can enjoy as well.
Yeah, and
You
we
know what?
posted some links on NCSA, and we'll be happy to post those again.
And if
Yeah,
they listen to watch Frozen 2 3 times in a row, they watch Frozen 2 3 times in a row. And if
I
it
think
keeps,
they're watching it 3 times in a row anyway, but that's my idea.
Yeah, we've received a couple of questions from people asking about links that we've discussed. And as Fada said, we will take all the links. Some of you have sent some in. Thank you so much. And we've mentioned some. So we will put those on the website and on Facebook. Okay, just so everybody knows. Okay, Fada, did you want to take another one or do you want me?
I'll take another one. Okay. So this mom is, since we don't know how long schools are going to close, right? And
Oh,
if
I
they,
think I already took that one.
no, this is another one.
Okay.
Since we don't know
No.
how they're going to close, and they might close even longer, should we take our kids out of the state?
Out of the state?
Should we travel with our kids to a non-infected area? For example, if a family is living in the Bay Area, could they go to Arizona or the Grand Canyon? There's a lot of open spaces,
I mean, I
so
guess
this is Alicia. I'm not against that. My family actually lives in northern Arizona, and I considered that until I realized that I would be pulling Newark, New Jersey airport germs all the way to my 80-year-old parents. So that kind of put a kibosh on that. But if people have alternate ways to maybe take trips, it's a mixed bag, right? Because we don't really know how many people are infected in different areas. So I couldn't tell you that Arizona is in fact, just because they have a low infection rate on record, that they actually do have a low infection rate. We don't have enough testing kits. People are not getting diagnosed because there aren't enough testing kits right now. Apparently that's going to be changed. So I don't know if we actually know how many people are actually infected. That being said, if you have a car, I mean, I have to say this, if you have a car and it's a short distance, and if you're careful at gas stations and you can eat in the car, I wouldn't recommend flying on an airplane. I wouldn't recommend, taking a long car ride where you have to stay in multiple hotels. But if it's a short distance, if you live in Northern California, there might be some day trips you can take to get out of town and just practice the same precautions, social distancing, wipe everything down, make sure you have enough supplies, all of those things. But long extended car trips, I don't think are going to be a solution for anyone. And I don't really think that even though it looks like on paper that there are areas that have less cases than others, that may totally be the real truth.
Yeah,
Now, I want to just say something about the flattening the curve effect here, in that, yeah, I think there's a general feeling that the less we travel, the more we hunker down, the less we come in contact with other people, the better chance that we as a society will have to flatten the curve, which means really reducing the number of infections, particularly the acute infections that require hospitalization. And I would just say, personally, my advice, not just for yourself, but just for the social welfare, would be to stay home as much as you can and not travel. Because when you travel, it necessarily, I guess, unless you're in an RV and you're stocked with every single thing you possibly need, but when you travel, it necessarily brings you into contact with more people, and you're crossing state lines maybe. And I think we should do what we can, and I realize that we have additional stresses to flatten that curve. It will, I believe, buy us time in terms of creating hospital capacity, in terms of creating therapeutics, for those who are ill and even acutely ill, in terms of creating a vaccine. So, I do realize at the same time that our families are in different situations, and we might need a little more leeway than other families, but still, I would stress flatten the curve when you can.
Yeah, remember, as much as like this seems to be getting worse day by day, if you do look on the news, there are a lot of things that are somewhat encouraging. I mean, just this morning, there's information coming out of India about cocktails of different antivirals that people have had good luck with, different cell therapies, many people in different countries working on the vaccine. I mean, even suggesting that that might be something that's going to be potentially possible in a couple of months. So as much as you can follow the recommendations and stay at home, really prevent the medical system from becoming overly saturated like it is now in Italy, where they're having to make those horrible decisions about whose life they need to just kind of let go of, and because they simply don't have the capacity to care for so many people. I think every day they say is really valuable in terms of fewer people that are infected. And yeah, it's just buying time for this to pass, and for the people working scientific interventions to be able to help.
Right, I agree. So here's a comment. I didn't know this was true. Amazon suspended shipment of non-essential items, prioritizing medical supplies and household staples. Did you already talk about that? No.
I think it's only.
We didn't talk about that, but I ordered a bunch of puzzles and they're not coming in until way later than I need them.
Oh.
Outside providers, I think they are still shipping like from their warehouse, but if it's listed as like from an outside vendor, then no, that was all suspended like a little bit earlier this afternoon.
Oh, okay. I didn't know that. Yeah, because some things that are necessities to us might seem like indulgences to somebody else, right? Like, my metal iPhone case for my son is an absolute necessity. But yeah, I can see how if you don't understand our circumstances, it doesn't seem like it.
Necessities.
What?
Cheetos.
Cheetos are a
Cheetos,
necessity,
yeah.
right? Yeah. But I wonder if, eBay, people who are selling privately, is our sense that the post offices are still open, the postal service is still working, FedEx is still working. You can go outside of Amazon to order things, I think.
Yeah, you can. You just have to be careful of gougers.
Right, but they're clamping down on that as well. So eBay and also Amazon, they've really clamped down on anybody and taken people off of their websites who are, trying to charge $50 for a bottle of hand sanitizer or $200 for a bottle of Tylenol. A lot of that has been stopped for the kind of, people who are looking to gouge society. They are saying that if you start getting a lot of packages delivered, potentially unpackage them like outside, leave the boxes outside. Then when you bring whatever it is that you bought inside, make sure that you wash, sanitize your hands. And, if somebody wants you to sign their little, whatever, the little computer device that you received it, waive your right and try and interact as little as possible with people delivering things. But I ordered some stuff from eBay just yesterday. So definitely those places are still running. Again, they want to keep running. They want to keep a business.
Oh, gosh, there are so many questions here that I can't keep up. But I guess what I want to say is that, this is the first of what we hope to be a series that we can develop for families, asking them questions. Keep writing in, ask us your questions. We'll attempt to figure something out to get back and answer them. Maybe we do a series called Cooped Up with Corona,
Oh.
and a side of autism, Cooped Up with Corona and autism.
Here's just one more question. We do have a couple more minutes. So my child's school sent home a bunch of programs. They seem to think this is going to fulfill what my son is entitled to educationally according to his IEP. Do you think we special ed parents will have any success in seeking compensatory services in a few months?
Let me take this question.
Okay.
And I'm sorry, my son is here. Okay. If this school suspends services for regular ed children, they don't have to do it for special ed kids. Now, if they open up, for example, some schools are opening up childcare centers where typically developing children are able to go and be there for a few hours. Then they have to offer the same for kids, special needs kids. But I don't think you're going to have a lot of success at getting them to pay for something, back pay for an IEP when everyone's suspended.
I also,
However, my advice is document, document, document. Write everything down. Add dates. Add people that were there. Add doctor's appointments. Add times. Add videos. Document as much as you can, because as much as things may be slipping during this time, you're going to need some evidence that there has been serious behavioral consequences of that, and that it's affected their education. So just as much as you can, document.
I want to make another point here, which is a lot of us who have kids who are more severe have our kids at non-public schools instead of in, public programs, special day classes within the district. And those non-public schools, I really want to stress, are particularly vulnerable to shutdown or severe financial stress right now, because they have to continue paying their staff when their staff isn't really providing any service. And it is, I think, and I could be wrong here, please correct me if I'm wrong, still unresolved as to what kind of compensation these non-public schools are going to be getting, right, from their respective departments of education. Because under usual, business as usual, you as the school, you do not get compensated unless that kid shows up at school. You only are paid for services actually rendered, right? So I think there's a lot of uncertainty, and I do want to say, I hope we can all cut our schools some slack here. I can understand the desire for compensatory education. I can understand the desire to do the best for your own child. But sometimes doing the best for our own children means also doing right by the institutions that serve them. And let's kind of, withhold any fire. Let's act in support of them. And then let's see what comes out later, what we can do later to make things better. But I know that there are schools right now, autism schools, serving our population, the more severe population, that feel that they might have to close shop permanently because they'll be so in debt. Anyway, that's my public service announcement on that.
I think, again, things are changing very quickly. There's going to be stopgap measures in place. Schools need funding, their ADA, even when kids are in there. The federal government is going to pay them for that, even though, because they have to keep the schools open. The other thing is that I think the same thing with insurance companies. Right now, everything is just changing so quickly. But the fact of the matter is, if they're not offering any services to general ed students, because of the shutdown, they don't have to offer services to special ed students. But if they sent out, for example, resources to a bunch of, general ed kids, or like, here's where you can, do your science curriculum or your science project, they'd have to offer the same types of resources for kids on IEPs.
Okay, now we are coming to the end of our time here. And again, I want to apologize. We did have a registration glitch with this particular share and care, and that absolutely will be resolved in all further events. So I really apologize for that. Second of all, as we mentioned, we hope to host more of these in the coming days and weeks. And if you have ideas for particular topics or today we were all over the map, right? But if you want us to hone in on something in particular and you have a topic or a speaker in mind, please email us at info@ncsautism.org, and we will definitely take that into consideration. Finally, does anybody on the panel have any closing remarks?
So let's start with Dr. Wachtel. We'll go around.
I mean, I think it'd really encourage people to, be kind to yourselves, cut yourself some slack, cut your kids some slack, recognize that, hopefully this is going to pass, somewhat quickly, but definitely not as quickly as we would like. and do what you need to get through. Do what you need to keep yourselves safe and sane, and what you need to keep your kids safe and sane, recognizing that things that, in an ideal world you might have wanted them to accomplish, and in an ideal world things that you wanted to do too. All right, so we can't do them now, but a few months from now, hopefully we'll be able to make those things up, and just have to kind of hold on until you can get to that time. But be kind to yourself. And again, we always tell all of our parents, in as much as they dedicate every kind of second of their life to their kids, if there's any way that you're able to take some amount of time for yourself to get a little bit of a break, even if that's 5 minutes, or and maybe it's not the healthiest thing, maybe it's eating a piece of like chocolate cake, or doing something you usually wouldn't do. Now's the time to do that, to be kind to yourself and help yourself get through.
Alicia?
I'm not going to mince words. This whole situation sucks for everyone, but we're going to get through it, and we're going to get through it because we're going to stick together, and we're going to help each other. So just continue to do that.
Thank you. Feda?
I guess just, to all the moms and dads out there that are feeling guilty, please try not to feel guilty. I think we're all doing the best we can do at any given moment. And if your kid wants that extra cookie or Cheeto, give it to him.
Yeah. All right. Well, thank you to our speakers today, and thank you to everybody who sent in comments and questions. We really appreciate it, and we will post links to this recording and also to our upcoming events, webinar events. Okay? So signing off. Thank you so much, everybody.
Bye.
Bye.